Hey guys, welcome back to Medical Coding with Blue. Today's episode is the 7 pro skill tips every medical biller and coder needs. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. All right, so Monday I started out with a letter from a viewer who was having a problem with a coworker. And I noticed that a couple of people came on and were giving their advice to that particular viewer, and they were saying that basically that she needed to focus on her own work and let her coworker fall if that was going to be the case. Here's the deal. I'm very proud of the viewer who wrote in because it takes a lot of guts to be able to talk about what's been going on. And they don't teach us this stuff when we are in medical coding school, right? We are responsible for our own learning in that department because basically school is just teaching you about coding and that's it, right? So that in mind, these 7 skills that I have come up with are the things that I have learned over time. I've been a medical coder for over 10 years. And having these and developing these skills has helped me to really enjoy what I do because it takes the focus off of something that's happening to me and it makes me be more proactive rather than reactive when something does happen. So I hope that you'll take these 7 skills and I hope that you will make them your own, and I hope that this will help you in your journey into medical billing and coding. So let us begin. All right, so the first one is developing a thick skin. Now, if you are in that horrible first process of trying to find your first job and everybody keeps telling you no because they want experience, developing a thick skin is really going to help you because you're going to be able to take a lot of that rejection and not let it deter you. You have to have a determined frame of mind. And getting that thick skin is going to let all of that rejection sort of just bounce off of you. It's the same thing for like when you really get your first job and you start to get these audits, right? And you're starting to have people tell you, well, you coded this wrong or you've done something wrong. It's a kick in the teeth, right? So you can't let it bring you down. You have to look at audits and things like that as a learning tool rather than, oh, it's a beat up session, because it's not. It's meant to help you to learn more. And not everybody knows everything going right in. I certainly did not. So because of that, I had to learn. And is it difficult when you're being told, yeah, you got this one wrong, and you're like, oh man, why did I get that one wrong? And it also helps you when you know you have to stand up for yourself and say, no, actually, I found this coding clinic, or I have this bit of information that is proving what I selected was correct. So that is something that you have to learn to do. And that's going to be part of the continued list here in a minute. But again, going back to developing a thick skin, it is going to help you not take it so personally when you get told that you're wrong. So as long as there's, a reason that, of course, if you were wrong, then you're wrong. Take the lesson and move on. Don't sit there and wallow in it and say, well, next time I'm going to make sure that I argue and argue and argue until I get my way. That's not the correct way to be. If you're wrong, then you're wrong. So developing a thick skin, guys, that's going to be the key to success there, because it's going to help you to neutralize how you feel and really be able to be objective about any kind of situation rather than your own subjective feelings coming out, right? You're going to be able to look at it in a very clear-minded way, right? So that is what I have to say about the first pro skill. The second one is practice active listening. This is a problem sometimes when people don't listen. You have to listen when people are talking to you. If you have a provider that is rambling on, or perhaps they are upset because you're trying to bring something to their attention and they don't want to hear it, you have to practice active listening. They're telling you something even when they are really upset, when they are overwhelmed with whatever you're bringing to them. You have to learn to work together above all else, but you have to listen to their needs and listen to what they're trying to tell you, because they're not always going to be upfront and clear with you either. Yes, they are some very intelligent people, but it doesn't mean that they are able to convey those feelings of, well, you're telling me that I'm wrong, Blue. You as a coder is telling me that I'm wrong. And I feel anxious about this because I'm supposed to be this intelligent surgeon and you're telling me that I'm wrong. So I'm going to lash out. So that is something that does happen. You have to be prepared and you have to say, okay, I can work with this. I'm going to listen to what they need. And it's that listening part that a lot of these providers do require. So learning to actively listen is really huge, because that is going to tell you a lot more. People show a lot of their actions by actions, physical actions, but they also show a lot of what they want and they need by the words that they say and how they say those words. So if you're having a provider that's like showing that they're confused about something, you need to change your approach. Actively listen and watch what they're doing, so that way you know, hey, I got to change it up because I'm not making my message clear enough. So that's the second one. The third one is use your voice to speak up, right? So a lot of times when, especially brand new coders and even veteran coders will do this as well, they don't understand something. And rather than ask the person that is trying to explain it to them, they will say, oh yeah, I know. And they won't say anything. Or they will say, oh yeah, okay, I understand, and not really. So if that's the case, you either have to go and find out some other way, so that way you can understand what's happening, because everybody's explanation style is going to be different. And if it's not in a way that is helpful for you, then you need to either ask for further explanation, or you need to find another way to figure out that answer, because people can't read your minds, right? And if they can't read your mind, they don't know that you're struggling. That's why I say to use your voice and speak up. Well, Blue, you don't understand. I'm a really shy person. I can't do this. That's the thing that gets me when people say they can't do something. Where does it say? Where is it written down somewhere that you cannot do something? Right? And that is just a long-term thing that I've always thought when people have said that to me. Well, Blue, I can't. Well, why not? Where is it written down that says that you can't? If you have something in your heart that you really want to do, then by all means go for it. But don't be the person that's putting yourself down and saying that you can't do something, right? So use your voice and speak up. Even if you're shy, it's fine. Even if you got sweaty palms, that's fine too. I went through that and I still go through that. There's times when, like, all of a sudden I get really nervous and my hands start to sweat. That's just something that happens to me. But it is using my voice to speak up and being like, well, actually, that's not really clear to me. I don't understand. Can you please explain it? Or I will do my research and I will say, I still don't understand this. I found this, and this, but this doesn't make sense to me. And I will go to somebody who I feel is smart enough to explain it to me and have them explain it to me. And that's the other thing too, is you have to look for those people that are going to help you in those times when you've done your research and you need a little bit more help, because we all need a little bit more help. I've talked many times about the one coder that I do reach out to, because she does know a lot. She knows how to help me. And I've known her for many years. She's my very close friend. And I trust her opinion. So that is something that if I had not found my voice to be able to speak up, I know for certain I would be continually lost on some things that she's helped me to understand. So it is very important. If you don't understand something, speak up, look for help. And that is the, the third one, okay? Number 4, research and stay educated. Now, of all the pro skills that you need, that is a huge one. Even when you get your certification, even when you have your job, even when you are in your clinic, you still need to continue to educate yourself. Not just for your continuing education unit's sake, right? To maintain your certification, but it is to empower yourself more. By staying educated, you stay motivated. Because when you stay motivated, you got that goal marker that goes a little bit more and a little bit more and a little bit more. And that's great, because staying educated and being well educated is going to help you help your providers, and in turn help the patients that they serve. The last thing a provider needs to do is worry about, is the coder going to select this correctly? Is the biller going to send this in correctly? That's the last thing they need to worry about. So it's on you to assure them that you know that you are continuing to educate yourself. You have these skills that you are putting into practice on a daily basis. And this is something that is going to help you. This would never hurt you, right? The continuing education would never hurt you. It's going to open your eyes to more things. It's going to keep you active. And it's just like a muscle. You constantly have to exercise, right? If you want to build huge muscles, you have to continue to exercise. It's the same thing with studying. It's an active muscle that you have to work. It's your brain and being able to recall information. Well, Blue, I just don't understand it. Believe me, been there, done that, got a t-shirt. Best thing you can do if you're not understanding it from a book, go to an alternative like YouTube. Search all the videos that they have about whatever it is that you need to learn more of. There are tons and tons of explanation videos about surgeries. They have active animations, beautiful, beautiful animations, right? On some of these videos. And some of them are very straightforward. There's very short ones. I've seen some that were 3 minutes. I've seen some that were 45 minutes. But watching those videos truly does help. And it's going to make something that seemed so complicated into something so easy. And they have every single specialty under the sun on YouTube. Trust me, there's a lot of different ones. Cardio, oh, there's plenty of cardio. Ortho, there's plenty of ortho surgery videos as well. Now, there's so many, I'm not going to list any of them. But it is important that you guys take that time, do your research. If you're assigned to a clinic, a specialty clinic, from ophthalmology to ortho to the pain clinic, whatever your specialty is, take the time, look on YouTube, see what videos they have for your specialty. Go on the internet and look for whatever websites that you can that will help you to understand what their documentation is saying, or what diagnoses can fall into this category. It's very, very important, and it will only benefit you. Okay, so next one is be adaptable. This is a pro skill. I probably should have said from number one, because this one is the one that people have the hardest time with. There are some people who, when they start as medical coders, they get comfortable with a particular clinic, and that's where they want to stay. They don't want to do anything else. They like that clinic. That's where they're staying. They're getting their time in, and that's it. Oh, yes, I've been a coder, and I've been coding for 10 years. Okay, great. What have you done? Well, I've done this one clinic. And that's it? No other clinic? Well, no, I mean, I did that, but yeah, that's it. Okay. You have to always want to expand. In order to be successful, you want to be able to have options when you are in coding, right? So when I first got here, I had a wonderful boss, wonderful, wonderful lady. Then I got another one, okay, after she left. And me and this lady just did not gel well at all. But because my knowledge base is very broad, this helped me to be able to get away from her as well. There's going to be people in your career that you're not going to be able to get along with. Me and this particular lady did not get along. It wasn't my fault. It was on her because I literally had no ill will towards the woman. It was her. So that's going to happen. And there's no rhyme or reason to it. I mean, I treat everybody with respect. I had done my work and I had done it very well. I had also assisted her and I had also trained her. So again, I had no ill will towards her. It was her. So with that said, because my knowledge base was broad and I knew many different specialties, many different clinics, when I went to the chief of our department to make my plea to get off of her team, I was able to make that move because I had had previous experience in other clinics. So because of that, it gave me the freedom to get out of a very toxic situation. Now, I knew for myself that that was toxic. So, and it's something that you have to be vigilant about. It's something you have to pay attention to because everybody in the field is not going to be your best friend, okay? And that is something that you have to know. And you can be the nicest person in the world. You can do everything right, but there's going to be people that may not like you for whatever reason. So with that in mind, you have to make sure that you don't get into one single area, that you make sure that you are able to go anywhere. You want to make yourself as flexible as possible to have that freedom. Because had I not had that freedom, it would have been, I would have had to go and find another job. Because literally this woman literally made me question at that time, like, am I doing the right thing? Am I even in the right field? Because it was so rough. It was very rough dealing with somebody like that. So that's just something to think about. Always be open for different options and adapt. And if they want to move you, if they want to make you a coder who goes from clinic to clinic so that you can be cross-trained a lot, it's even better for you. Yes, is it uncomfortable in the beginning when you're trying to sit there and learn a new clinic, perhaps every 6 months? Of course, but then what happens after you start doing it for a while? It starts to get a little easier, and especially if you've been doing your research. And if you know how to do your research, it's even easier. So that's why I'm telling you guys, it's very important that you are able to adapt to anything and be willing to accept challenges. That's another thing too. People don't want to accept new challenges. There's coders that I have seen. I'm not going to do that. I've known many of them. I'm not going to do that. I'm not working in that clinic. Well, why not? It's too hard. Are you kidding me? I don't want to work ER. I don't want to do this other clinic. I would not want to do ortho. I'm like, what's wrong with ortho? You know, but that's just me, you know. Guys, you have to be willing to adapt because you never know what other job opportunity could be out there for you if you have the experience and if you've taken the time to learn different clinics. You just have to be willing to do that. All right, the next one is find a mentor or someone that you trust. I do talk about my friend on the episodes here and there, and I trust her. I trust her because I've learned this, that you can't always trust everybody and what they say. When I was at my second job, one of the girls, she had maybe been coding for about a year, okay? She'd been coding for about a year, but she was new to that facility. She'd been there for a few months before I got there. And one of the things that she was saying, and I'm brand new myself. I don't have very much experience. I'd been 3 months into the job, okay, with my other position, and then that was brand new to this facility. And so one of the things that she was saying was, oh, if they're saying that the patient is being treated prophylactically, you got to pick that up. And I'm like, but I don't think they have that. And she's like, no, you still pick it up anyway. And I'm like, really? So overhearing this, my friend was like, no, you don't do that, because prophylactically means they're treating this patient for the possibility that they may have it. Since this is the outpatient setting, you only code what is confirmed. So that's why I always say you have to, whenever somebody's trying to give you advice, make sure they can give you a reference or how are they arriving at this interpretation, okay? Because it's very important. You don't want to just take anybody's advice just to be willy-nilly. Oh, okay, well, they said. At the end of the day, an auditor is not going to be able to accept that. Oh, well, so-and-so said that. Well, yes, but you're a certified coder too. So you should be able to know the rules and understand how the coding goes. That's my advice on that one, okay? And so the last one, bringing it home, ask for help. You know, that is one of the hardest things to do. And it's even hard for me to do. It's hard for me to ask for help in other things, right? In coding, it's not a big deal. I reach out to my friend or I do my research and I'm good to go. But if you are having a hard time with this and putting your own pride aside to be able to ask for help, that's a problem. In medical coding, it is a team sport. Believe it or not. Yes, we work independently a lot of the time, but it is a team sport. You're working with the doctor, you're working with the CDI, you're working with the biller, you're working with the other coders, you're working with your supervisor. There's a lot of people that goes into this coding symphony that goes on every single day when we work, right? If you can't ask for help, it's a problem, because that means that you think that you know it all and you don't. Even I will admit that I don't know everything. And there's times when people will tell me things or they'll ask me questions and I gotta be like, wait, hold on a second. Let me look this up because this is new for me. Keep in mind that not every place is gonna have the same rules. Not every place is gonna do the same things. So because of that, you wanna make sure that you are preparing yourself and knowing how you can find your resources. And even when I get stuck, I do reach out for help. So if you are in that situation where it's hard for you to ask for help, it's okay, because we've all been there. But reach out for help. There's plenty of people out there who will be willing to help you. There's mentors with the associations themselves. There's tons of tutors on LinkedIn. I am a tutor myself, and you can find my rates in the description box below if you're interested in setting a session up with me. Now, again, there's plenty of tutors on LinkedIn. You do have a choice out there, guys. But whatever you do, look at who you're asking for help. If you're looking for a tutor, find out how much experience they've had. Are they an active coder? And what are some of the things that they've done before? What are some of the other clinics? Don't be a credential snob, whatever you do, because I have found that it is the caliber of the coder is different for everybody, right? And just because somebody has one credential does not count them out as less knowledgeable than somebody with a alphabet after their name. So that is something that you got to keep in mind. So knowing what you're getting yourself into, doing your research is very key. And that is something that I want to pass on to you guys today, is ask for help when you need it, because there's no sense in struggling when there are so many people out there that are willing to help. So I'm going to wrap this one up. I hope you guys will take these 7 pro skills and make them your own. It will make your life a lot easier and you won't feel like you're struggling if you know that it is okay to ask for help, that you know you need to develop a thick skin, that you've got to practice this active listening and all of the other elements that I have said today. It's only going to help you guys. So I'm going to wrap this one up. So I hope you guys have a great weekend. Please like this, share this if it helped you, subscribe if you haven't already, and I will see y'all on the next video. Bye.